I am so sorry, AMP2. I got rudely interrupted at the end of the last lecture, so I'm going to pick up right here where we left off, and again, I am sorry. What I was trying to say was that you want to be careful not to just be focused on the heart. You want to make sure that you understand what's happening at steps 5 and 10 on this picture, where we're talking about the blood is in the lungs, it's dropping off the carbon dioxide, loading up on oxygen, and then heading back into the heart. And at step 10, where the blood is in all of the body tissues, same thing, except in reverse, unloading the oxygen and then getting all the carbon dioxide waste. So I just wanted to make sure that we weren't just super focused on the heart itself and that we know what's happening at steps 5 and 10. But again, you want to have this pathway down pat. You may see it as an essay question on a test. Okay, the notes then go into a little bit of detail about the coronary circulation, which is talking about the blood that's pumped by the heart to the heart that is just for the heart itself. And these notes go into a little bit more detail than I think is necessary, so I'm going to be skipping a couple things. But coronary circulation means the blood, it's 5%, that is pumped to the heart itself. So there's a coronary artery, and it is branched into left and right, and then this talks about more branches from there. I'm not picky that you know those, but off of the aorta there's going to be a right and left coronary artery, and they are bringing the heart itself its oxygenated blood so that those contractions can continue. Okay, and there you can see those coronary arteries on the outside of the heart. And when those coronary arteries are disrupted, we can result in a heart attack. So the technical name for a heart attack is the myocardial infarction. If there's a blood clot or a fatty deposit within that coronary artery, anything really that disrupts the blood supply to the heart, those cardiac cells can have cell death within minutes. So if they are not receiving the oxygen that they need, then they are not going to make it. Sometimes you can talk about an alternate route of blood flow within the myocardium, but most of the time, if you have a heart attack, there's been some kind of interruption. This just talks about specifically if the blood flow to the heart muscle is slowed during the ventricular contraction. If you have a chest pain with the heart attack, that's called angina pectoris, and that's if there might be an obstruction from the coronary blood flow, as in with a heart attack. And so some patients have pain, others maybe not. But anytime there is myocardium cell death or tissue death from that obstruction, it's going to be considered a heart attack. This talks about kind of different varieties and what happens, but basically from the point of that blockage, anything downstream of that is going to have some damage. Sometimes patients will see a pain that radiates into their left arm, or others might have painless heart attacks. They might not feel it. But heart attacks are responsible for about half of the deaths in the United States. Okay, again, this goes into a little more detail than I think is necessary, but it's talking about of the heart itself,